Well, good morning, everyone, and welcome. I'm Jim Irwin, Chair of the Employment Practice Group at Pierce Atwood, and with me today is Rod Stanley, Director of Loss Control for MEMIC. We want to thank the Portland Regional Chamber for the opportunity to present this webinar to you today. Rod and I are so glad we can finally start talking about today's webinar topic. Spring seemed to have finally taken hold until Saturday's snowstorm, but it looks like we're back on track, and we now have some hope of finding our way out of this dark tunnel of uncertainty that we've been in for the last 2 months. So there's a lot of discussion now about reopening the economy, and that seems like a misnomer for a lot of, I'm sure a lot of you, having been dealing with HR and other operational issues all throughout this pandemic. There was certainly no slowing down of work for us, having to become familiar with unfamiliar new laws and programs and make sure people knew about those at a very rapid pace. But now we can take a breath. And unlike the speed with which the coronavirus and the shutdown hit the workplace, the resumption of operations is going to be a slower and more incremental process. We think the vast majority of workplaces will have time to plan and plan correctly for this to happen. It doesn't mean we won't have uncertainty as we go along, because the timetable isn't completely clear, and the economic harm yet to fall on us isn't clear either. But at least there are some very clear and positive things that we can do. And one of the most important of those is to create an OSHA-compliant plan. So today, here's an outline of what we want to talk about. First of all, a little bit about what's driving state leaders' decision-making. Then we'll talk about how to think about bringing back your workforce. We'll get into the why an OSHA-derived infectious disease preparedness and response plan is so important. And then we'll get to the real meat, which is how to create that plan. And then finally, we'll talk about the importance of communication, enforcement, and documentation. But first, I thought it would be interesting to take a look at some other approaches to infection. So Dan, are you queuing this up?
It should be queued up.
So if this isn't going to fly, we need to move on. I don't want to keep folks waiting.
It should have played. Did not stream. Did it not go through, Jim?
No.
I'm sorry.
Oh, okay. So I thought it was going through on my screen, so I apologize. Here we go. Let's apologize. Here we go.
All right. We have no audio.
Yeah, I'm sorry. My computer's messing up on my end. Sorry.
All right. Well, if it's glitchy, we'll just we'll just move on.
Okay. Yep, you should be able to take control now, Jim.
Okay. So sorry about that, folks. What that was a clip from Monsters, Inc., which you may have briefly recognized, of the 2319 code for dealing with the infection represented by the presence of any child contamination. But following it, which was the key part, was a training exercise from what appears to be China. It might have been Korea, we're not sure, which shows an amazingly similar process undertaken to deal with COVID-19. So the point was simply a little bit of humor to show that there's some very extreme measures being taken around the world with regard to the COVID-19 situation. Now, I want to talk a little bit about what our government leaders are hearing about back to work, and in particular from experts. Now, we know that the big question here is balancing getting back to work with the risk of overwhelming the healthcare system. That's always been the core problem with the pandemic. And the Massachusetts High Tech Council has given this issue a lot of consideration, and it has boiled it down actually to 3 elements, 2 of which I want to talk about briefly. The first one is the idea of segmentation, which means the breaking your workforce into segments and then sequencing their return to work according to their risk of infection and having a bad response to that, which would have the effect of lowering the hospitalization rate. And then the other one is reducing what's called the R0 factor, which is essentially reducing the rate of spread. We'll talk about each of those quickly. So with regard to segmentation by age, which is of course the big variable when it comes to how people are reacting to this disease, the High Tech Council has developed the data you see here, which talks about hospitalization rates by age and death rates by age. And the conclusion is that by either excluding people 60 and above from returning to work or slowing down their return to work, it could greatly reduce the hospital burden without affecting the vast majority of the workforce. Now, with respect to the R0 factor, this is really it's a fancy term for saying how to reduce the rate of spread and a metric for measuring the reduction in the rate of spread. So in this case, the key metric is, can we reduce the rate of spread to less than 1 infection caused by an infected person? So that obviously means that a lot of people can't infect anybody if you're going to have an average rate of spread of less than 1 new person per infected person. But that's the metric that the scientists and epidemiologists are taking a very close look at as they decide when and how we can move forward. So when we think about returning to pre-pandemic operations, we think about what do we face when we bring our people back to the workplace. We know that it's going to be a long and incremental process. We know that it's going to vary by state, by industry, with different restrictions and guidelines. It's now in Maine and in other states, it's varying by region within the state. And whether it takes a long time or a short time, it's not going to be like it was before. So we have to get ready to embrace really some new normal behaviors in the workplace involving distancing, disinfecting, hand washing, mask wearing, things like that. But we also have to be ready to confront the anxiety, apprehension, and the need for adaptation that's going to come along with all of that. So the OSHA-Compliant plan that we want to talk about today is really important, we think, because it's the best way to control the rate of infection, the risk of infection, as much as possible. It provides the safe operation in fact by doing that. It provides a sense and a perception of safe operation through effective communication, training, and enforcement. It will create confidence in your employees and in your customers. It will lower the likelihood of claims against your organization. It will make you better able to defend claims if you get them. And it will make your business and every business who does this collectively contribute to reducing the chance for another shutdown from this or some other pandemic. And I just want to mention quickly, mere infection is not the only risk that we're talking about here. We obviously, we want to have a plan that is taken seriously and that is effective, because if you don't, people will quickly migrate away from the practices that we need them to follow in the workplace. There'll be more spread. That's going to impact productivity and morale. You're going to have an increase in employee claims. There might be workers' comp claims. If they're employees, they probably will be. But you also have some risk of negligence claims by third parties. You have a risk of discrimination claims for age and disability if you're not really careful about following the plan correctly. You have confidentiality risks with regard to healthcare information. I mentioned third parties who may sue. I put waivers on there only because we hear a lot from people about whether they should be asking their customers or their vendors to be signing waivers with regard to liability for anything COVID related. And our general view is that it's not a great idea. It's, first of all, it's not a good way to deal with a business partner. But second of all, it's really not very practical. There may be exceptions. I certainly would agree with that. But in general, it's really a shortcut to what you need to be doing, which is a safe workplace. But for all of this liability stuff, we put out an alert on Friday, which is available on the Pierce Atwood website. So one of the key elements that I want to just emphasize before we get into the guts of this is the importance of meeting your employees where they are as you bring them back into the workplace. And there are a number of ways to think about that, but you have to recognize that they're scared about getting sick. They're scared about losing their jobs. Just being in confinement for the last almost 2 months now has taken an emotional toll. Some of them are going to be angry. Some of them are going to be skeptical about what's being done. And some of them are going to be in financial distress. So all of those things contribute to some pretty fragile employees that you really want to let them know that you understand that that's kind of where they are. So a couple ways to deal with that. First of all, as you get ready to bring them back to work, we recommend that you communicate to them how you will protect them before they come back. I would not leave this to just the day they come through the door, but rather you should be communicating with them in advance about how the workplace is going to be made safe for them. If it's possible to do, find a way to involve them in the actual development of the protocols you're going to ask them to follow. You should be clear that you want their input, but at the same time, the final decisions will come with the employer, from the employer. This is not a negotiation, but it is actually a search for good ideas and input and participation. And make sure they understand that things will change. The infection rate might increase, things might have to get more strict, it might vary in ways which we can't anticipate right now. So things will change. So you don't want to overcommit in your communications to your employees. And the other thing I want to emphasize is, and this is a bit of a dicey issue, I'm sure, for a lot of companies, but it is to your advantage, to the extent you can do this, to share information about your company's financial situation. You don't want to mislead employees about their job security one way or the other. You want to be able to bring them into the solution by telling them, here's what the company has to do to stay healthy, and here's what their part in that effort is. And making them part of that big picture solution can be a very helpful boost to morale. And now I'm going to turn this over to Rod, who's going to talk to you about, get us started on the nuts and bolts of creating a plan.
Thanks, Jim. The OSHA's role, I think we're all familiar with the term, we're OSHA and we're here to help. Hopefully that's getting a few smiles out of folks out there. But in this case in particular, with the stress this is placed on, the entire country, the workers, the employers alike, OSHA's role has been initially here to really try to get information out to help. It does regulate pretty much all of the private sector. The general duty clause is kind of the underpinning out of the act itself, which says that an employer is responsible for providing a workplace that's free from recognizable hazards. And of course, this one currently, the coronavirus is the hazards unseen and different and causing us all to work and live differently. Clearly, OSHA is going to expect employers to deal with that hazard like any other hazard in the workplace. There is a lot of information from OSHA. It's key in managing legal risk. And we have a couple of sample programs that we'll be talking about here. And I think, like this slide says, we have to be realistic that if an employee is not just complaining, but if they're insecure, like Jim was talking about earlier, if they're unsure, or if they feel they're being treated unfairly, there's a number of different things that occur that will get an employee to drop a dime and call OSHA. So that's another reason why we really want to try to stay compliant to the best of our ability. Yeah. Now this, the OSHA 3994 document, that's been out since March. I think it's based on the WHO and CDC recommendations. I expect most of us have seen some version of this. It's relevant at home as well as in the workplace. And I think this will make a basis of many companies' safety operations as they return to the workplace. If we go to the next slide, Jim. Now there are these 5 at least, and they're coming. More of them are coming online, but these are one-page. They call them checklists. They're really bullet point lists that OSHA's put out. It's again taking these top items in the in the OSHA documents and making them relative to the various industries. And there's guidance on engineering controls, such as, and again, we've seen many of these. I think retail is one of the places probably most of us saw some of these recommendations going into place, where there's 6-foot spacing actually in the lines where you even queue up. Things like this are spelled out. All of these documents have really good guidance for any business that's starting back up in these industries. So if now the other couple of standards here that are really fairly relevant and quite specific are the PPE standards. And again, if hopefully you folks are familiar with this, but the general concept of the PPE standard under OSHA is that the employer evaluates their workplace and then determines what personal protective equipment is needed for the individuals that work there in the various departments. And then the employer has to certify that. And that's a specific requirement that somebody in management looks at what the hazards are and what the PPE is required, and then they sign off by certifying that. That will be required as part of the new hazard level identification that OSHA's put into the COVID-19 situation, for lack of a better term. Similarly, bloodborne pathogen standards, again, they are, they're clearly a risk from any type of first aid or dealing with people in close quarters. It is designed to be, bloodborne pathogen is mainly intended to be dealt with through engineering and work practices, as well as the term universal precautions, which I think that lends itself very well to what we're talking here with this COVID-19 epidemic, is that basically we're assuming everybody's positive for COVID-19, and whether it's wearing face masks to protect others or to expect them to do the same and keep our distance, it's all about again controlling exposure. So go ahead, Jim.
Yeah, Rod, if I could just add one point on
Absolutely.
the PPE issue. OSHA does not consider face masks, homemade face masks, cloth face masks, to be PPE because they don't protect you, the wearer. They protect people from you in that they stop what you're breathing out, but they don't protect you from what's incoming, because they're not fit tested and they just aren't up to that standard. So that doesn't mean they aren't worthwhile by any means. It simply means that when OSHA talks about PPE, they're talking about things like N95 masks. They're not talking about homemade face masks. So just keep that in mind for terminology purposes. If you go about creating your plan, you don't want to call something PPE that isn't in an OSHA plan.
Yeah, in fact, I think Jim just brings up a great point that I think most employers want to at least consider, if not plan for, how are you going to deal with face masks in the workplace. Because there are situations you go to any retail location right now, and most of the people that work at the retail location at Hannaford or Walmart are wearing face coverings. Like Jim says, they're not respirators, but they are face coverings, and we need to have employers that expect to have that in the workplace are going to want to have a plan for how to deal with that. So thanks, Jim, for pointing that out. The CDC guidelines, Center for Disease Control, they are very involved, and of course hopefully most of us have seen some of the history. It's kind of catching up now. We're seeing some, there's some History Channel shows and stuff on the 1918 H1N1 pandemic, and remarkably similar photos of people in face coverings and many people hospitalized and that type of stuff. So the Center for Disease Control has been doing this for a long time. They've been putting out this information for decades. Most recently, a lot of the guidelines came out around the SARS epidemics from earlier this century, along with Ebola virus. There's extensive information in there on for airport travel, for cruise lines, for identifying sick employees, that type of stuff. There's also more material coming online for specific procedures. I know the poultry processing industry has gotten a lot of attention lately due to the proximity those folks have to work. So there has been some guidelines put in place for that as well by the CDC, as well as, for instance, if you want to look for what steps you should take if somebody is sick, if somebody does have COVID-19, that's where you can go and find detailed information. You're not going to find that information in the OSHA standards really ever. There will be, it will be in these CDC guidelines is where you'll find it. Go to the next slide.
Okay, I'm gonna jump in here. Yep. And obviously, I think folks, we assume most of you, if not all of you, are concerned about Maine's reopening scheme. And so that's kind of our focus. But whatever state you're in, it's really important that you be very aware of what your state is requiring. And as we're learning from seeing the checklists that are coming out from the Maine DECD, it can be very, very detailed. So it's really important to stay on top of this. So if you're a multi-state employer, then obviously that your burden multiplies with every state you're in, because you've got to monitor and comply with all of the relevant reopening plans that affect your workplaces. And So you've got to think about whether you want to, are you going to start up in the first state that allows you to, or are you going to wait for the last state? Or are you going to do something in between? And how are you, if you have competing or different or inconsistent kind of internal workplace guidance from your state, how are you going to reconcile those conflicts? You have to really think all that stuff through. I don't think any of that's insurmountable, but there are things that you really need to think through carefully. And of course, this is all changing, as I mentioned, rapidly. I want to encourage folks to go to the Maine ECD website and look at some of the checklists that have been put up so far. The general employer checklist is very consistent with what Rod was talking about, what OSHA provides and the CDC provides. When you get into the industry-specific checklists, which I've listed them all on this next website, I'm not going to go through them, but I just want you to know that's the status as of Saturday. When you look at some of those checklists, they are very detailed. So if you have one of those businesses, let's say you're in the restaurant business, and if you're one of the 12 counties that can open, you better get up to speed on that quickly. If you're not, you can expect that those rules are going to be coming to Southern Maine in June, when we expect that Southern Maine will be able to reopen things like restaurants. So people need to be aware that this is going to be there's going to be a lot of minutia to deal with regard to this. Now back to you, Ron.
Thanks, Jim. So why do you need an infectious disease preparedness and response plan? Well, it would be the best way you can be able to protect your employees. If you go to this guidance on preparing workforces for COVID-19 publication, that is the most detailed publication that OSHA put out. It's, I want to say 35 pages or so, and it is, that's where the hazard classifications of very high, medium, and low risk are identified, as well as measures that employers should take to protect their employees in those risk categories. There is, again, CDC is the probably the most reliable place, either the Maine for state-specific or federal for national information. There's also a guidance for safety and health plans. If you're writing those in general, if this is something new to you, there is the plan that Jim's team has put together. We have one as well. I believe we're going to put links to these or make them available to folks. And again, it's geared towards having a written plan to say what you're going to do as you come back into the workplace to protect your employees. There's, again, industry guidelines for certain industries we've already talked about, as well as state checklists. So all those will be key in our efforts to stay open. So just a quick review of MEMIC's pandemic recovery safety policy template. As you can see, I mentioned before, the OSHA's guidelines for safety and health programs these days has actually 7 key categories. These are those. One of them I left out here just for graphics is employee involvement is a key piece. So when we consider the putting a program together, it's always critical to have management commitment involvement. That's very key. Hazard identification, assessment, how do you categorize folks, how do you disseminate the information. You'll see in the sample plan we have, there is there's things like there's a community risk level notification form, so that people know what the actual risk level is and what's required. Something that gets posted either in a near time clocks or on a company intranet. So again, there's so much information on this. One of the things that can make people feel a lot more secure as they come back to work is that they know that they have an employer who's going to take the most reliable information and put it at a place where they can get it. We also We also have an example of a daily contact tracing log that has been successful for some employers to actually track employees who are unable to keep the appropriate distance. It helps in case somebody does get tested positive or suspected, you then know who they've been in contact with for the prior 14 days, and you can really expedite the tracing practices. And also a company, a fairly large company here in Southern Maine, implemented it as an essential business back in early March, found that they started out with 20 or 25 situations where people were coming in touch with each other. And by paying attention to it, they quickly got it down to 1 or 2 a day in a place of employment of around 80 people or 100 people. So it was fairly effective. We also have employer vendor screening tools. I think Jim's going to talk about that here in a while. What's your temperature? Do you have symptoms? Those kind of things. Those are all important to controlling the spread, but also some legal pitfalls, which again is great to have Jim here for that. We've also got detailed procedures for somebody returning back to work after they've had their 14-day quarantine. So again, we're trying to get specifics. And if there is one overarching thing that we've tried to put into this plan is it's kind of the quality mantra of say what you do what you say, and then prove it. If you go through this, it's not enough just to say it. You're actually going to be able to prove that it's been done through employee involvement and training and documentation. So if we go to the next slide, Jim.
Okay. So as Rod mentioned, both our organizations have done template plans, and this is, they're based on the same core sets of resources, but they just approach it a little bit differently. And you should, both will be available to you. You should use whichever works better for you, or take the best of each. Whatever works to make sure that your organization gets the best plan for you. But this is the outline. If you open our plan, you'll see that it's in this order of things that you'll be constructing your plan to make sure you cover all these things. And then we have also a sample policy because you want to have a policy. This whole thing flows from a policy. So this is just some sample language that almost any organization can use, and you can certainly adapt it to your own company as you see fit. So to start building a plan, you need to pull together the requirements for specifically preventing infection from COVID-19 from various sources. And we've already mentioned a number of them. You've got in this slide, in the slide deck that will be available to you, you will find the 10 steps to reduce exposure from OSHA. You can get the CDC preventing getting sick at that link. Just go to the CDC website. Where the main checklists are on the DECD website. So those are all going to be part of the steps you're going to consider when you put your plan together. I wanted to mention here also a couple of things that you shouldn't overlook. And one of them is the HVAC system in your place of business. And so that, for example, if you're a tenant, and many office businesses don't own the buildings that they're in, they are tenants. This is a box you should check. You should talk to your landlord about how much does the system recirculate air that could conceivably contain infectious vapor. What kind of filtration system is in place? How often, what's the rating? How much does it trap? How often is it changed? That sort of thing. I know in our building, our plan is calling for, we're a tenant, and we've gone to our landlord and we sat down and figured out that, the HVAC system is going to get a little bit of an upgrade in terms of the frequency of checking the filters and that sort of thing. So we feel comfortable that we've done what we can, and I would urge you all not to overlook that. Similarly, if in you're building common areas that you don't control, what is the landlord doing with regard to containing infection risk there? What's the cleaning schedule? What are the cleaning materials? So you can tell your employees when that's going to happen. Again, give them some comfort that the areas that you don't actually have control over and that aren't part of your plan that you can execute on are being attended to in an appropriate way by the landlord. So I would keep that very much in mind as you build your plan. Now we're back to Rod.
Thanks, Jim. Now the categories of risk out of that OSHA document 3990, I believe it is, the four I mentioned before. The big cutoff point here between high and very high is that those folks are exposed to known or suspected sources of COVID-19. So the big difference is the main thing between high and very high is that there are aerosolized procedures going on that can make the virus go airborne by processes being done in the lab or healthcare setting. So again, I think most of us are fairly secure in not having to deal with this. I mean, many of our healthcare professionals have been dealing with this for a couple of months now anyway, and will continue to. When we get into where most of us will fall, it's in this medium or low risk category. It's, we're not around known or suspected COVID-19 patients, but there is frequent or close contact with people. That tends to be most of our folks in retail, depending upon manufacturing settings. Certainly in the food service industry, a lot of the production line is difficult to get that separation. And then low, so there's no required contact with people known to be suspected to be infected with COVID-19. So, that can be somebody in the back office type of person, somebody who just isn't dealing one-on-one with the public. It really kind of classifies those folks. And that is one of the things that you will want to do as you come back into your workplace, see what measures can you take to minimize the amount of people who are medium, and can you move them into that low contact area, reduce the chances of them being exposed. Yeah, they're good, Jim. Yeah, you're right on. Yeah, your timing was perfect, and your timing was better than mine. Yeah.
I did it by accident, but that's all right.
No, it was good. So so we want to analyze groups of employees on what their potential exposure is. That's again, starting out figuring everybody's probably it's probably medium, and what can we do? What type of engineering controls can we do first? Because the hierarchy of controls, some of you folks may be familiar with, is elimination or substitution, right? And you have engineering. Personal protective equipment is actually supposed to be the very last. And so when it comes to looking at these exposure categories, what things can we do to reduce the risk to somebody who's, say, in a medium category, which means they may come in contact with somebody that's COVID-19 positive, then that's where, say, the plexiglass screens are coming in. That's another thing that we're seeing fairly routine in the retail industry. I know in several of the big manufacturing industries, I know several big sawmills in Maine have continued working as essential industries, and they have used extensive engineering controls of placing plexiglass in between workstations that would ordinarily, have people that would be closer than the 6 feet. So again, you do as much engineering as you can. The elimination is what we've all been doing here. That's what just taking us out of the workplace, keeping people, stay-at-home orders, all that stuff is kind of the classic elimination. But we're all at a point where we can't eliminate this thing. I think Dr. Fauci was quoted, I think today or yesterday, as saying we're probably not going to eradicate it. At least not anytime soon. So Administration stuff, I think Jim touched on that, early on, but it's something many employers are doing is staggering their workforces, having half the shift come in, say they had 100 people on day shift to start, they break them into 2 shifts, they have 50 on day shift, they have 50 on night shift, there's things like that going on. But again, just to physically try to distance people and keep them from congregating. Other administrative procedures is kind of as mundane as shutting down the lunchroom or going into conference rooms and say, because of, say you had a conference room that you used to have 12 chairs in and a nice big conference table, and because of social distancing, you do your math, you need about whatever it is, 28 square feet or 30 square feet per person. So many employees would be just taking seats out of conference rooms, again, to make it so you physically can't get people in there sitting down to exceed those levels. Personal protective equipment, again, that's really a last resort. It does need to be at least N95 mask if you're using it as a protection from airborne virus. You need gloves, hand sanitizer, all that type of material. And you really need a program and a process to go with it. When would you use it? What people need it? Again, the goal is to eliminate that to the best of our abilities. And then the big thing about safe work practices is in these high and very high risk operations. Those are full gowns, face screens, respirators, gloves, decontamination afterwards, all that stuff. And of course, and everybody else, and really everybody in general, but all of us at high, very high, medium, and low, hygiene is critical. Hand washing, trying to keep your hands off your face, out of your mouth, away from your eyes, all those things are absolutely essential. And with that, I think I'm going to turn it back over to you, Jim.
We have a question here that I'd like to toss out. The question is, if a business is allowed to return to their office by the state, but does not necessarily need to return to operate effectively, do you recommend not returning until there is less risk? So
I'm glad you're here, Jim.
Well, I'm happy to answer that. And I would say, I think that's a very reasonable approach. If your business is operating well, and you're not taking serious economic hit from having to have people work from home, which maybe not everybody can do that, or there's a host of reasons why that could be bad. But if it's not, I think that's a smart thing to do. The only risk that I would point out, and this is something a lot of us are thinking about, who've been working from home and are now looking at bringing people back, is over time, that's going to have an impact on the culture of your workplace. People get used to working from home. They get used to a whole different set of surroundings and habits and maybe a little bit more relaxed accountabilities and that sort of thing. And then getting them to come back, maybe they aren't so anxious to do it. Maybe, there could be, it's not going to be universal across all your employees, but you need to be sensitive to that. And I think one way to address that is to just have your managers be in constant touch with your employees, see how they're doing, pick up signs that maybe, gee, we got to get these people back. This thing is starting to not work very well. So that would be my response to that. I think that's, frankly, the risk you want to be paying attention to if you can work from home. That's the one I'd be the most worried about. And so I'm going to move on now to, really, we're now getting to the meat of the plan, because now you're going to start identifying those preventive measures that your workplace is going to have in its plan based on the various risk levels that may exist by employee populations. So if you have employees, for example, who work in large open spaces with a lot of other employees in close proximity, then maybe you got to move your stations apart. Maybe you want to have face masks. Maybe you want to reduce density by having less than all your people come in at the same time, and that might be an example where you bring some of your workforce back, leave some of them home, and maybe they swap every week or two, so that you don't lose lose connection with the people that haven't been coming in, but you still keep your density down. You're able to maintain the distancing that you need. Another example would be where you have employees who are exposed to customers or the public, and then you want to consider screening the customers, screening the public, physical barriers, that kind of thing. So those are all the kinds of things you're going to want to take into account. And one of the things that's not on the slide, but I do want to mention is, as you do this process, you really need to walk through the entire workday, beginning with where employees are parking, how they're getting into the building, their use of restrooms, breaks, access to coffee, stairs and elevators. You need to have a flow plan so that you have one-way traffic, that sort of thing. And then copiers, access to supplies, how people move about the office and visitors. And then when do they leave? So everybody's not running out the door at the same time and crowding in stairwells and things like that, or elevators. So you really need to I think you need to work through the whole workday as you figure this out. And I just have a couple of quick examples for you to consider. One is for a sales employee who I think would be a medium risk based on OSHA's hierarchy, because that person is exposed to customers and needs to attend sales meetings. So you've got to have some infection prevention measures that are specific to that person's job duties. So that means clamping down on in-person meetings when possible, not allowing large conferences. Again, the same kind of distancing stuff, face masks. Maybe they work from home when they're not out meeting with customers. The point is you need to tailor it to that employee. Now, for an IT manager, this is probably a low risk because there's no exposure to the customers or the public, but there is exposure on a regular basis to maybe a high population of coworkers. So maybe you've got some hardware sanitizing that has to be put into place. Maybe they do all of their work remotely as opposed to going, from computer to computer. And again, ensuring distancing for them. So that's just a couple of examples. They're by no means exhaustive, even for themselves, and certainly not to illustrate all the different permutations of employees and workplaces.
Hey, Jim, we got some questions coming in on respirators. One is an N95 mask for OSHA required regardless of setting? And as an OSHA authorized instructor, if you're going to use it to protect employees, it has to be a rated NIOSH certified respirator that has a fit factor, and you can be fit tested for. So I would tend to say yes. Now it follows up with, masks and 60% alcohol-based hand sanitizer are hard to find to purchase. Are there any alternatives as far as OSHA is concerned? And I haven't heard a lot. I don't know about you on that, but I haven't.
I have not. And again, on the mask situation, I think the N95 is for the vast majority of workplaces, it's not needed. It's not necessary. It may be a nice to have, but it's not required. And I think having people use cloth masks that are pretty extensive and cover the face well, that are multi-layered, I think you'll get what you need from the mask requirement with that. So, and the hand sanitizers, it's just a problem,
Yeah, I think supply and demand is starting to catch up, but.
Yeah, it's starting, but there's distribution, there's all kinds of pieces that have to come together for that.
Yeah.
So
yeah.
Are we good on the questions for now?
Yeah, I think so. That's good. Thanks.
All right. Let me just talk briefly about testing, and we're going to move through this fairly quickly. But I want to just give you some things to think about, and then you'll have the deck to refer to. So in testing there's multiple kinds of testing. There's the simple screening questionnaire, there's temperature taking, and then there's actually testing for COVID-19. And then there are testing employees and testing customers, vendors, or other people coming into your workplace. And it's, it's not perfect, but it can provide an early warning of infection and allow earlier action to prevent spread. And I think that's the value of it. So it's really you have to look at your own risk, and you have to look at the feasibility with your own workforce about whether you're going to do testing or not. So more specifically, we talk about screening. Now we're talking about people coming to work every day, every shift, or every visit if they're from the outside, they're not an employee, is a screening questionnaire that basically asks if they have any of these symptoms. And this is the breakdown of symptoms that the CDC provides for what the symptoms are and how they appear for COVID-19. So a simple screening questionnaire, it's non-intrusive, but it is health information. So if you capture that information, then you've got a confidentiality obligation that you need to protect the information. And you may have customers or members of the public that simply don't want to give you the information, and you're going to have to be prepared to deal with that what if. Some companies do self-screening, and so I wanted to give you just more information about that. I don't really have a strong recommendation on it one way or the other, but I think there's some pros and cons to it. New Hampshire is actually mandating it, and it would be worthwhile to consider incentivizing people to adhere to it by maybe enhancing your leave policies, for example. So if someone knows that if they have a symptom and they report it, that they can go home and they will get paid leave of some kind, as opposed to they're not going to get paid, then that's an incentive. It works both ways. So that's an incentive to imagine symptoms as much as it is an incentive to report them. And that's a balance you're going to have to deal with. But anyway, I think it's an option depending, again, on whether you have the people to do it, the people to treat any information you get from it confidentially, and will it have integrity. When you're talking about just a little bit more on screening, there's some examples on this slide about where it's being done and how it's being done. And Colorado's governor announced that temperature checks at workplaces will be part of their reopening. So that's going to impose on employers in Colorado. You got to go get you got to get thermometers, and you got to set up a protocol for doing this. And we know some grocery chains are doing it already. Amazon, of course, being high tech, has got cameras spying on everybody, and cameras apparently are picking up their body temperature as well now. And in Wuhan, China, they do it 4 times a day, if you can believe what's coming out of China. So that would be a very thorough way of doing it, but I can't imagine employers in the US are going to want to go to that extent. And then there are some cons that you need to think about. 36% of the cases don't have a fever. They don't present with a fever. Carriers are contagious before symptoms, or particularly before fevers show up most of the time. And then the equipment is difficult to get, particularly quality equipment. I've heard reports of employers getting thermometers that were junk and they were unreliable. And again, as we've mentioned, you have the confidentiality issue. I do want you to be aware, though, that the EEOC has formally endorsed the idea of temperature taking. So you don't need to worry about any sort of violation of Title VII or the ADA. And of course, the Maine Human Rights Commission hasn't spoken on this, but I can't imagine they would take a different position. So if temperature testing is important for your workplace, you're safe to do it as long as you treat the information confidentially. And then another slide just to tell you a little bit about, if you're going to do temperature checks, who should do them and how they should do them, so that you have a process that, again, has integrity, some reliability, and is consistent. And then the last item is on COVID, on this testing question, is on COVID-19 tests. The EEOC has also said that those can be taken in the workplace without violating federal discrimination laws. So again, you have a green light there if you want to do it, but we typically wouldn't recommend it in your workplace. Now, some workplaces may need to, and then of course, but for the average employer, we don't think actually doing these tests right now makes sense. It's a significant burden. The turnaround time varies by tests. If the tests are actually doing their job, we should have a positive rate of less than 10%. And so that means 90% of the time you're taking tests and you're getting no useful information. So it's, again, you need to balance all of that with why your workplace might specifically need that. We haven't talked much about visitors. We made some references to it, but here are some thoughts on visitors to your workplace and what kind of restrictions you might want to consider for them as well. So I think most of these things have been mentioned: screening, barriers, rerouting, foot traffic, FedEx drivers, for example, give them a new place to drop off packages that doesn't bring them into your workplace. I mean, those kinds of things you want to be thoughtful about, because visitors, they just as likely as employees to be carriers, and so you really want to be bringing them into your thought process. I did want to spend a minute on, Rod had mentioned this question, and they have materials of this in their plan template, but it's we wanted to give you what the current CDC guidelines are on when employees can return to work after they've had a positive diagnosis. And there are really kind of two forks in the road on this, or one fork, two prongs, I should say. One is if the employee is not going to be tested, which I would hopefully say is maybe what used to be the case. As tests become more and more available, everybody will get tested if they present with symptoms. But if there is no test, then you got to meet the following criteria, as you see there: at least 72 hours without a fever, and without the aid of fever-reducing medicine, and then improved respiratory symptoms, plus at least 10 days since the symptoms first appeared. So as you can see, that's how you can go back to work if you don't have a test. And if you do have a test, first two things are the same, but then you need 2 negative tests in a row, at least 24 hours apart, before you can come back. And we think it's a good practice. This is not a CDC thing, but we think it's a good practice. If you have someone out ready to come back, you should ask for a doctor's note to confirm that they are in fact fit for duty. And if you become aware that not your employee, but an employee's family member has been diagnosed with COVID, you want to apply the same criteria to the employee who's been in the presence of the family member. So again, you've got to be, loose ends like that can come back to bite you if you're not paying close attention. All right. Going to shift gears away from the kind of the specifics of the plan around infection control and talk about communication, which is a critical issue in making the plan effective. And there are a number of reasons why it's important to do that. If you're communicating about it regularly and effectively, people are going to follow it. If they do follow it, obviously the risk of infection is minimized. We think you gain some long-term cultural, I want to say antibodies, but that's the wrong word, because that's the opposite of what I'm saying, cultural acceptance of compliance. And workplace cultures in which it is an accepted norm that you comply with regulatory requirements, should be a high value. I mentioned liability risk, so you get the benefit of that as well, because you have a plan that you can demonstrate, as Rod said, say what you do and do what you say. You can show that you do it, and so you're able to show that you met any conceivable duty of care when it came to the risk of reinfection. It's an opportunity to demonstrate leadership, which your employees will appreciate, and you get trust, as I've indicated. And then a little bit about how. It's really important that employees believe that management believes in the plan. And That's why the communication is so important. We recommend boiling down, in addition to giving employees the plan and having them review it and sign it to say that they've read it, we think you should have simple summaries of the elements of the plan posted in the workplace to remind people. For example, if they're in the restroom, what are the things that pertain to being in the restroom? If they're in the break room, what are the things that pertain to being in the break room? Have those posted and available for people. You're telling employees the what, but you also want to tell them the why. You want them to understand that you had a good reason for choosing the pieces of the plan that you did. And there are OSHA posters that you can get. I don't know how specific they are to the COVID-19 situation yet, but I'm sure OSHA will, if it doesn't already, have posters that you can get, much like the employment posters that you need to post. We talked earlier about changing circumstances. You need to communicate those very quickly. Your communication needs to include encouragement to report concerns, and you need to mean it, so that if for whatever reason, if people want to report that they're concerned, they don't think the plan is good enough, they think there's a gap, they think certain employees aren't honoring it, they think there's risk somewhere, you need to listen, not be dismissive, and someone needs to own the accountability for acting on that information. Even if acting on the information is simply communicating back to the employee who brought the concern up that you've looked at it and the company's satisfied that things are safe. Even if that's the answer, that needs to happen, and you're going to want to document that as well, which I'll get to in a minute. Rod, before we go to the last couple points here, anything you want to add on training, since I know you is a very important part of your view of this?
Yes, well, again, as we outlined in our plan, the one of the big things is to have a terminal objective in your training, is to, what exactly are you looking to accomplish? What do you want your, what do you want your trainees to, to actually take in? Like for instance, everybody will want to have, a training program that makes sure people know what the symptoms are for COVID-19, how it spreads, what to do if they feel symptoms. Similar to that, you're going to have a series of those learning or terminal objectives. And then you've got to have enabling objectives. How are you going to do that? What kind, is it going to be a video? Is it going to be a meeting where a supervisor reviews this stuff with a crew? Is it going to be an email you send out? There's a variety of different ways you can do that. But then, of course, how do you document it? It's like, I think Jim's program has, one of the sections is the sign off is a documentation on it. It's absolutely key. But again, finding a method to assess effectiveness is key in training. So you are going to need to, once you've established what your terminal learning objectives are and people have been through training, management really should periodically go and determine if people have retained what's been taught to them. You can do it following training with a quiz. We highly encourage that, some type of knowledge check. But then also go into the workplace and evaluate folks is key. Thanks, Jim.
Thank you. So enforcement is really another important element, and I think it obviously requires some finesse and some sensitivity. You've got people coming back. I mean, you don't want to be writing people up because they didn't wash their hands or they got in within 4.5 feet of a coworker, or they forgot their mask when they get up from their desk. I mean, that's not the point here. On the other hand, if you let the failure to follow the plan go, it's going to metastasize within the workplace. It's just human nature. So for unintentional violations, like people forgetting, you need to coach people about that and make it clear to them that it's not going to be acceptable to keep forgetting your mask or whatever they do that's not following the plan. If it becomes clear that certain people are just not going to follow the plan unless they are forced to, then you have to discipline them. I don't think there's any way around that. And if you have intentional disregard of the plan by your managers, you really have to act on that and make sure that that stops, because you cannot have your employees think that the company is hypocritical about that. And the other thing I would say is the early steps you take when people are back to work to enforce your plan are going to set precedent. And that precedent, you're going to have to live with that precedent for a very long time. So, and one of the things about precedent is it kind of sets expectations, which later on, when you deviate from it, makes people wonder if you had some reason other than that you haven't been clear about for having deviated from the precedent, and that feeds discrimination claims. So setting precedent that you think is the right precedent and then sticking to it whenever possible will help reduce the risk of people saying, why am I getting singled out when he's not getting singled out for this behavior? He did the same thing I did. That's why you have to be consistent. And of course, there are obvious risks if you don't do it. So, and the last thing we want to talk about is documentation, which I'm sure most of you have heard about 1,000 times in the HR context. But this is another area where documentation is going to be really, really important. So if you have a system for keeping track, for example, of reports of sickness, and the actions taken in communications with employees about this, how are you going to document that in a way that protects confidentiality if you're capturing any medical information, but shows, for example, employee X reported COVID-like symptoms, and so employee X was sent home, and then, okay, well, now employee X wants to come back to work, and how are you going to keep track of that? So that is employee X actually ready to come back to work, and will employee X have to go through your back to work protocols? And if so, make sure that they do that. And all of that you want to have some record of. Okay, I think that covers that slide. And then I have a couple more on this. Not going to go through these in detail, but OSHA has some very specific requirements with regard to having to record injuries or illnesses, and anybody who misses days from work, a death, obviously, missed work, restricted work or transfer to another job, medical treatment beyond first aid, those kinds of things are all OSHA recordable injuries. They go into a log that you are required to keep, and if OSHA ever comes to visit you, they will ask to see that log. And you want to make sure that you're actually accurately recording these things. So you may wonder, well, wait a minute, if someone has COVID-19, why is that an OSHA recordable injury or illness? If I don't know where they got it, how will I know that it's recordable, right? Because how do I know it happened on my workplace? Well, that's a good question. But if you have a workers' compensation claim from somebody who claims to have contracted COVID at work, and that claim ends up, you look at the facts and it appears that that's the most likely way that they got it, then that I think would be an OSHA recordable, and you would need to put it in in the log. And then there's also OSHA reportable, which are things you have to tell OSHA about. You don't wait for them to come look at your log. So that would be any kind of work-related inpatient hospitalization. So again, if someone contracts COVID through work, whether in your workplace or at a customer's or whatever it is, and they end up in the hospital, you have to report that to OSHA. And then finally, it's really important when you get complaints from employees or others about things that they think are unsafe or that aren't compliant with your plan or aren't compliant with an OSHA standard, you need to keep a record as well, not only of the complaint, but also a record of what the company did with the complaint. How did you respond? Did you address the condition if it wasn't up to snuff because the employee was right and there was something that was unsafe? Maybe some part of the business wasn't following the plan, whatever it is. Did you address it and did you make a record of it? So when you do that, you're in a much better position to defend against any kind of claim that you were lax when it came to complaints. And also you're in a much better position if the employee claims that you retaliated against them for making the report in the first place, if you took the report seriously. And then the last piece of this that I want to mention is that if you do get an OSHA complaint, OSHA is going to require you to fill out what's called a rapid response questionnaire, which is an online questionnaire that you have to fill out in response. And they'll use that to decide whether they need to do an inspection or not. So if you have a plan in place and you're able to report that in the rapid response questionnaire, then it will greatly improve your chances of not having an inspection, because you'll be able to satisfy OSHA that you are doing what you need to do to have a safe workplace. And Rod, I'll ask you, do you have any last words before we say goodbye?
Yeah, Jim, I've been reviewing the question the person or the folks asked about, is it really N95 mask for OSHA regardless of setting? And I think, again, I think this is what we're talking about, for a minute or so here, is that the N95 is required for really the high risk or very high risk, where you are working with known COVID-19 positive individuals. So there is, the hazard is known. Now, in all of the guidance documents OSHA has been putting out, where we are at a medium or low risk, so whether it's construction or restaurants and beverage vendors offering takeout, OSHA clearly says to allow workers to wear masks over their nose and mouth to prevent spread of the virus. So it's not a respirator. They're pretty clear about it. It's a mask, and it's a face mask. So if the person who asked that question, or the folks who are asking that question, if you are looking for protection from spreading the virus, then just a standard, it could be a homemade one. It could be, there's a huge amount of those coming online for just face coverings. Those would be appropriate in a situation that's in the medium or low categories. I just thought that was worth trying to explain a little clearer.
Yeah, thank you for that. I think that's really, really helpful, because there's a lot of pressure, a lot of indication from the authorities that masks are going to be in our future for a long time to come. And we need to know what that means, what kind of a mask and in what situation. So that's very helpful.
Yeah, and again, like I say, it's to prevent the wearer from spreading the virus. So
I want to thank you all for your time and attention today. I want to thank the Portland Regional Chamber for hosting this event. This webinar and the 2 template plans that we've mentioned will be posted to the Portland Regional Chamber website. If there are any questions that we didn't get to, we will respond to those in writing, and you'll get those as well. If that's the case, watch your email. I don't see the chat, so I don't know. We hope that this has been worth your while as you plan for bringing back your workforce, and we want to wish you the best of luck getting your employees back to full productivity in a safe and legal way. So have a great spring, everyone.
Thank you.